event on the second Tuesday of every month, our schedule permitting, and on the second Tuesday of every month, we have our learning, Connect and Learn. Let me sincerely welcome and thank Dr. Olayinka Jibuna for accepting to be our facilitator this month. Dr. Olayinka is a consultant psychiatrist. She is the founder of the Freudian Center, one of the leading outpatient substance rehabilitation outfit in Lagos. She's a passionate wellness practitioner. She's also an EAP practitioner. Dr. Olayinka Jibuna is also a radio presenter. I'm so sure you will be richly blessed being part of this learning event today. On your behalf, I thank her, because she has other commitment this morning, for the sacrifice she's made to share a wealth of experience with us. Dr. Jibuna, you're most welcome. Thank you for being part of this learning event.
Thank you, Reverend. Thank you for having me. Good morning, everyone. Today we'll be discussing emotional hygiene in the workplace. I'd discussed this over the radio, and Reverend heard because usually on our radio show, we record our shows and then upload on YouTube. And Reverend had listened to the show on emotional hygiene, and then he said that, oh, he would want us to discuss it at the learning event and just get more people to understand what this concept is about and help them to apply it in their daily lives. And that's why we're here today. So it's not a very common concept. I know that we're very familiar with hygiene in terms of other areas of our bodies. So we talk about personal hygiene, talk about oral hygiene. I've put a diagram here that just shows how we're very, very informed, aware of hygiene in other areas. So some people will say, oh, you know, I need to take care of my oral hygiene, and then they will brush twice a day. They will visit the dentist for scaling and polishing and all those things, you know. Some people, we talk about personal hygiene, and we're very particular about how we, you know, scrub our bodies, and we go for that body scrub to make sure that our skin glows, and we make sure that our clothes are clean. So we're very familiar with hygiene in other areas. Some people would even take it a step further and say they want to clean out their colon, you know, and those are the people that will do the enemas and the colon wash. Reverend, I don't know if you're familiar with this. So people do that often, you know, go there and clear out the colon. Some people say, oh, I want to clean my liver, you know, and they drink all kinds of teas to detox their liver. Some people say, I'm going on a fruit fast, you know, and the aim of that is just to clean out the liver, you know. So these are hygiene processes that we go through from time to time. But the truth is that we neglect the hygiene for the brain. You know, we focus on other areas of our body, but we forget about the brain box, the engine, the power box for the entire body. Every organ in the body is able to function because of our brain. You know, I'm talking to you now because my brain is functioning optimally. I'm able to see clearly. I was able to wake up this morning and get up and walk and get out of my bed because my brain is working optimally. So it's important for us to take care of our brain. And one of the ways in which we do this is, you know, emotional hygiene. Are we together? Am I carrying you guys along? Mm-hmm. Can I get a wave if we're still together? Can you hear me?
Yes.
Yes, we can hear you. Okay.
Yes,
okay.
we can hear you. We unmuted our audio to avoid interference.
Okay. Can I carry on?
Yes, sure.
Okay, so just to let us understand that the brain is key to the functionality of every other organ in the body. So you can't take care of the others and leave out the brain, you know. So today's discussion is just to lay emphasis on the brain and the need to be more focused on caring for our brain. Okay, so What's going on? Reverend, did someone touch my slides? Okay, so you're controlling the slides now. Okay. So what's emotional hygiene? It's being mindful of our psychological health and adopting brief daily habits to monitor and address psychological wounds when we sustain them. It just has to do with when you want to brush your, when you want to have good oral hygiene, you make sure you get the right toothpaste for you. You know, you discard your toothbrush every 3 months. You know, you make sure your toothbrush is in good order. You know, just to make sure that you, and then there's a certain way you brush. You know, to make sure that you have optimal oral hygiene and your teeth and your tongue remain healthy. You know, same way in emotional hygiene, there's certain daily habits we should adopt as individuals to keep us healthy emotionally and psychologically. You know, although the brain performs all these functions, you know, the brain also is in charge of our emotions, our feelings, you know, our psychological health. In a nutshell, our mental health. The brain controls our mental health. And we need to put certain practices in place, certain habits in place to help our brain stay healthy. Next slide, please. So I wanted to share this video, but because it's PDF, it won't play. So I've attached it in the chat room. So I don't know if is anyone familiar with this video that went viral at some point. It's in the chat. So if you play it, it's just a guy.
Let's see if we can play it from here. Dayo, can we?
It's in the chat.
Dayo, confirm if we can play it. The back end people are working on it to see if we can play it.
I don't know if we can hear that. Are we familiar with this video that went viral? So there's this video that went viral with a Chinese guy talking about emotional damage. I don't know if you're familiar with it. Hello.
We can hear you. Let's see if we can get the our back-end people to play the video for the benefit of those who may not have seen it.
Okay, sir.
Otherwise, Dayo, can you work on that, please? Confirm if you can hear me, Dayo.
I can hear you, sir. I'm working on it, sir.
All right.
Hello,
Thank
Doc.
you.
Hello.
Doc,
Hello?
in the meantime, Dr. Benjamin Adebisi is engaging you.
Okay, good morning, sir.
Yeah, thank you very much. The picture
Hello?
is actually the video actually played well. Yeah, I'm very familiar with the video.
Okay, from the chat. Okay.
Yes. And
Yes.
please, we are following you. The issue is we all unmuted our audio to avoid interference, you know, I mean background noises in your conversation. So, or in your lecture. So we are actually following you. So we could just respond via the chat so we don't tend to interrupt you, but we're actually listening to you. The audio is clear, but all audios are being unmuted. Or being muted,
Okay.
as a matter of yeah.
Okay, okay.
Okay.
Okay, we now have the video. Let's see if we can play it. Dayo, thank you very much for your support. You may now play the video. The audio we can't. Do we have audio on it?
Emotional damage. Emotional damage. Emotional damage.
So just a funny video just to illustrate what we call psychological wounds. So when we talk about emotional hygiene, we have to emphasize the concept of psychological or emotional wounds. Can I see the next slide? Psychological wounds are wounds or situations that hit us randomly, unexpectedly, on a daily basis. So you go about your regular routine or your daily life, And you could get hit by, psychological trauma or psychological distress at any point in time. Sometimes it might be not even on your own account, but now where emotional hygiene now comes in is how we're able to navigate through this injury when it hits us. So psychological injury can come in different forms. For some people, it comes in the form of trauma, and trauma is very broad. The scope of trauma can be very broad. So trauma ranges from be it psychological to physical to sexual to financial. So trauma is quite broad. But in the field of trauma, we talk about adverse childhood experiences, playing a big role in trauma responses in adulthood. So there are certain experiences that children might have gone through that, unbeknown to them, can present as trauma responses in later life. So it can range from neglect, emotional neglect from parents, financial neglect, sexual abuse, trauma, physical abuse. The interesting thing about physical abuse is that it might not even be physical abuse towards the child. The child just experiencing physical abuse to being administered to someone else, or a loved one, a mother or an auntie or someone else in the household experiencing physical abuse on a regular basis can be traumatic for the observer, who might be the child in that situation. So situations where there's neglect, where there's abuse, where a loved one gets incarcerated or imprisoned, or where there are untreated mental health issues in a family member, that can also be traumatic for young people. We also have instances of abuse of drug abuse, alcohol abuse in the family member. So these are the whole form what we call adverse childhood experiences, which can result in trauma responses in certain individuals, and then we see it as they progress in life, as they progress in adolescence and adulthood, we start to see the manifestations of these early childhood experiences. So trauma can be referred to as, trauma forms a major part of psychological injury. We also talk about rejection. We go about our daily lives. Rejection happens every day. At a point, we even take it like it's a normal thing. We get those rejections every now and then, but they still are psychological injury. We have grief. Everyone in their lifetime is going to experience grief at some point, because at some point you would lose your parents, you would lose a loved one. The older you get, the likelihood of grief occurring is even more apparent. So grief also forms a psychological injury, because for a lot of people, they navigate through life fairly well, but when they get to that point where they become bereaved, then it becomes a new, unexpected experience, and a lot of emotional or psychological issues can, start from there and then spiral out of control. So that is a major psychological injury. We also have things like disappointment, criticism, especially negative and hostile criticism, which is recurrent and frequent. And then we have loneliness. Loneliness is a psychological injury. And then failure. Next slide, please. So as we navigate through life, psychological injuries are inevitable. However, our response to it, or how we're able to survive these injuries, is dependent on the kind of our regular emotional hygiene. So I'll give an example. If your oral hygiene has been very poor, you don't brush often, you have plaques, you have cavities, the likelihood of going to see a surgeon and needing to get that tooth extracted at some point is more likely to happen, because over time emotional hygiene has been poor. Oral hygiene has been poor. So the likelihood of going to the dentist one day and they say, oh, we have to take out 5 teeth, because the long-term oral hygiene has been poor, is there. Same with emotional hygiene. If emotional hygiene has been poor, when psychological injury now hits, the likelihood of the person coming down with something severe, some emotional distress, some mental health issue, some disorder, is more apparent, because emotional hygiene has been poor over time. Am I carrying everyone along? Please just wave at me or say hello in the chat if I'm carrying you along, so I can go over that again.
Yes, you are.
Okay, so the emotional hygiene over time is important as a shock absorber when things happen. Now, we talk about emotional immune system. Every one of us has an emotional immune system. Just like how we have the immune system for physical health issues. Your regular immune system is there. You know, if it's strong, when COVID hits, you might not get COVID. When Ebola comes, you might not get Ebola because your immune system is strong. You know, same with the emotional immune system. We all have our emotional immune system, which we refer to as self-esteem. When your emotional immune system is strong, when emotional injury hits, the likelihood of you bouncing back faster or quicker or able to even bounce back is there. But if it's weak or if it's poor, the likelihood of you really coming down and getting to a phase where it's difficult to come out of, or getting into a hole that it becomes difficult to come out of, it's more possible or more apparent because the emotional immune system has been poor over time. So our emotional immune system, which is our self-esteem, helps as a buffer against emotional pain. And it also helps us strengthen our emotional resilience. So our self-esteem is something we do not joke with. Yes, it's difficult as an individual, it's difficult to even gauge your own self-esteem. But we say self-esteem fluctuates. It's difficult to tag someone and say, oh, this person has a healthy self-esteem. So in terms of self-esteem, we can categorize it into three. We have low self-esteem, we have healthy self-esteem, and we have overinflated self-esteem. So people fall into either of these three categories. But self-esteem actually fluctuates on a daily basis. It's not a thing that remains in a certain place constantly over our lifetime. So a person can have healthy self-esteem and then something happens, there's an emotional injury and it drops and it becomes low. However, what we're trying to say today is that when it drops, we're encouraging you not to let it remain at that level, you know, put in certain measures to help it come back up and be healthy again. Because if you leave it low for too long, other issues can now start to creep in, you know. You can dip into depression, you can dip into drug abuse, or so many other things can creep in because it has stayed low for too long. Same with overbloated self-esteem. Some people look like the self-esteem is up there, but it's overinflated. They are also in a weak place because when certain things hit them, because of that overinflated, because they're trying to keep a certain facade or a certain persona, you know, they don't even address the issue on time or as they should. So the two extremes of the poles are very dangerous. So it's the best way the best place to be is actually in the middle, which is where you remain healthy. Although it fluctuates, but you want to maintain it at that healthy point in the middle. Next slide, please. Okay, so now there's emotional hygiene which we need to maintain over time so that when emotional psychological injury comes and hits us, we're able to survive it. We're able to, whatever disappointment comes, when we lose a loved one, we're able to survive it and bounce back from that adversity as quickly as possible. The truth is that just like how when injury occurs on the outside, so you have an accident on the outside, you have a wound, you would bleed on the outside. You know, you would see that wound, you have a cut on the leg, you would bleed, and then you will need first aid to put that in place. It's the same thing emotionally. When emotional injury hits us on the inside, we bleed emotionally. We bleed emotionally and we need emotional first aid. These are some things we don't talk about, but they're actually very important. So emotional bleeding it refers to the feelings, when the feelings of a person start affecting his or her actions and emotional states. And on the long term, it can lead to unpleasant implications. For example, bitterness and resentfulness. I'll explain what I'm saying now. If a person is hit by psychological injury and the person hasn't been putting hygiene measures in place, the person can now start to bleed on other people. So I've been working in civil service for 5 years. I love my job, but suddenly the federal government says they can't pay, you know, everyone again, and they start to retrench staff. So unexpectedly, my boss gives me a sack letter. You know, I didn't see that coming. It's a disappointment. It's a rejection. You know, I didn't see it coming. It hits me. Now, of course, I expect my self-esteem to drop or dwindle or shift. So if my self-esteem was at a 7 all this while, it's expected for it to drop to maybe a 4, because I might start to question myself. Oh, was it the task I did not do, or was it that I did not drop my reports on time? I could start to question myself that was it that I didn't meet, or is it because like one we saw in the newspaper recently where they said the woman, the head of NPA, did not give Rotimi Amechi a birthday gift. So because she's not giving birthday gift, he said she cannot continue to be the NPA chairman. So that kind of person now getting a sack letter will say, is it because of the gift I did not buy for the minister? Or is it this, or is it that? So in those moments, it's only normal to question yourself in those moments. And then what happens after that is that you could actually start to bleed emotionally. So people around you in the house can start to see certain behavioral patterns coming out of you because of the feelings you're having on the inside. Remember, in mental health, we say your thoughts plays out in your feelings, and your feelings now show in your behavior. The thoughts are on the inside. The feelings might show slightly. So your sadness, anger, happiness, it starts to show slightly. But what most people will see will be your behavior. That's what becomes very apparent to those around you. So someone that is now bleeding emotionally because of the psychological injury they've experienced could now start to snap at everyone in the house. So they wake up days after the sack letter. The person wakes up in the house and is shouting at everybody, starts to scream at everyone, is in a really bad mood, is taking it out on other people. Or for some people, they now start to go and drink excess. Maybe this is someone that used to drink a bottle of beer once at social events once in a while, now starts to drink every day, so the behavioral pattern starts to change. But a lot of times, most people will say, they will just ignore it and say, maybe because of he was recently sacked. They leave the person like that. But what happens is that when you leave it like that, when you don't apply first aid, it has long-term implications. It can spiral out of control. So it's not uncommon for us to see in our practice someone that is now an alcoholic, and they say, he started drinking a lot when he lost his job. But everybody just looked at him as he continued drinking because they didn't know what to do. And then 10 years after, this person is now an alcoholic falling into the gutter, and they're looking for a rehab to help the person. Because at that point when there was a job loss, when the person was bleeding on other people, getting angry or feeling sad, not wanting to spend time with other people, isolating themselves, people around them didn't know what to do. So that's where first aid comes in. And we talk about, even when it comes to physical first aid, a lot of people don't even know what to do. And this is why we're sharing this information. This is why we're talking about these things. Because when this situation happened, a lot of us are clueless, completely clueless. You hear about someone that drops. I heard a story about a young man that was hit by a vehicle and he had a fracture and was bleeding, And the funny thing is that they didn't even know what to do in terms of first aid. They didn't know they could have tied the leg in a certain way to reduce the bleeding and all that. And the guy just bled out. And before they got to the hospital, he was dead, And everybody kept talking about what a wonderful person he was, how he had changed so many people's lives. But in that moment when he needed that first aid, nobody around him knew what to do. This is why we have these conversations. When we talk about things like CPR, you learn, if I go for a CPR training today, learn how to do mouth-to-mouth resuscitation for someone that drops and is unconscious. The day if I ever need CPR, I cannot apply CPR to myself. So these are things that if I go for a CPR training, I need to carry people around me along, so that if I ever need CPR, there are people around me that are aware of know what to do, that can administer it on me. Because that CPR that I've gone to learn is not for me, it's for someone else. So first aid, usually a lot of times we learn it for people around us. And when we go for these trainings, when we go and learn these things, we should carry people along, because it's a vis-a-vis thing. Reverend, I hope I'm speaking the English well. What I learned for others, vice versa. I'm learning it, but I'm learning for others. Other people are learning for me. So these things are very important. So same with emotional first aid. Going back to the man that now becomes an alcoholic many years after because he lost his job. Because at that point when he lost his job, the family members didn't know what measures to put in to help him recover from the sadness he was experiencing, the disappointment, the anger outburst, or whatever emotions he was portraying at that point. And they just allowed it linger for too long. And because the self-esteem had dwindled at that point, He has started to engage in behaviors that he would normally not engage in, behaviors that were now out of character, and then over time became a chronic or long-term problem that no one else could now solve. So these things are very important. I put it here, what emotional first aid measures do you put in place for yourself? So this is where our emotional hygiene comes in. As individuals, we should have daily habits, daily patterns we put in place to help us stay emotionally healthy. For every one of us, we are wired in different ways. Some of us are introverts, some of us are extroverts. We're wired in different ways. So when we feel stressed or when we feel unhappy or when we have our own default mode, some people, they're unhappy. They might just want to binge on Netflix for 2 weeks. And once they binge on Netflix for 2 weeks or 2 days or whatever, they come out feeling refreshed, rejuvenated. Some people want to hit the spa. Some people want to hang out with their friends. Maybe their girlfriends or there's this positive energy they get from them that they feel that once they're in their presence, they lift their mood and they help them feel better. Some people keep pets. It's their pets that help them. Some people will take a walk on the beach. For some people, so different people, everybody has their own style, but the key thing is identifying what works for you. There's so many options. Some people love to garden, some people love music, so what works for you? But the important thing is identifying what works for you, because in those moments when the psychological injury hits you, that's when to activate that thing, activate those habits, activate those behaviors, because you want to be able to come out of that mood or that feeling as quickly as possible. When sadness on the short term is okay, it's normal, it's fine. But sadness that remains prolonged becomes a problem. For us to even classify a person as depressed, the person must have been sad persistently for 2 weeks, at least 2 weeks. When sadness starts to drag for that long, other symptoms start to creep in. There are other symptoms that start to creep in, fatigue, and anhedonia, and so many other things. And before you know, you're saying the person is clinically depressed. So these things are very, very important for us to learn and understand. Next slide, please. Okay, so now moving on to practices to boost emotional hygiene. First, the practices we need to learn are hinged on 3 major pillars. Now I talked about in terms of the activities we can engage, there are so many options, but it all starts with you first, paying attention to your feelings. So that's why we're trying to raise this awareness. You as an individual, you need to be self-aware. Knowing myself, in terms of being mentally healthy, you need to know yourself. You need to know what makes me tick. What are the things I love? What are the things I don't like? A lot of times you can ask someone, what do you like? The person will take 10 minutes to even think about it. Before they will have to think before they can tell you. It shows a poor level of self-awareness. To be self-aware, you need to know. If you don't know yourself, people will define you for you and tell you who you are. And most times they're even wrong. You are the best. You're in the best position to define yourself. So you as a person, you need to be self-aware. If it means you, after this conversation, sitting down and just grabbing a pen and paper and just thinking, who am I? What makes me tick? What are my likes? What are my dislikes? What helps me relax? When I'm feeling stressed, what are those things that help me feel better? What are those conditions that help me? What are those situations that help me rejuvenate, that help me come alive again? A lot of times you say for introverts, there are usually activities that are one-person activity, loner activities, activities you do by yourself. So it's not uncommon to see introverts on that list will put activities that are solo activities, maybe watching a movie, binging on a movie, playing a game that is just solo, as compared to extroverts that draw a lot of their energy from other people. So on that list, an extrovert will have more of team activities, or playing basketball with others, playing football with others, going out with friends. So extroverts will have more team activities on that list, while an introvert will have more solo activities. It's not abnormal, it's just the way you're wired, the way your personality is wired, and it's okay. But the important thing is that you need to know. I've met a lot of people that when you tell them you need to know your person, like, doctor, all these things you have written, leave me. I don't do anything, that's my life. That is already problem brewing. That is problem. So that, because the day it would hit, they won't have anything to fall back on. They won't have anything, any routine, any hygiene measures that they built over time that can now help them bounce back quickly. Is at that point they'll be helpless because they don't have any routine activities that help them bounce back from injuries. So these things are very, very important. It's important for us as individuals to know ourselves. I've also said that it's important for us to identify positive and negative feelings. You know, yes, there are times we feel happy, there are times we feel sad or unhappy, but those negative emotions, it's important for you to be able to identify it. So if it seems like you're snapping at everybody often, you know, it seems like today I snapped at people a lot in the workplace, tomorrow I snapped at people a lot in the work. Instead of letting it go on and it becomes a 1 week thing, maybe it's time to step back and say, oh, I'm snapping at people a lot lately. What's going on with me? Am I stressed? How am I feeling? What's going on? Is there something, is it the bad news I got last week that is hitting me like this? No, it's important to do that assessment of yourself. A lot of times you hear a lot of people misdiagnose these things and say, oh, he's been snapping at people a lot, it's bipolar. They say things like that, which are not funny because you're now trivializing major mental health issues as everyday. You're turning everyday situations to major mental health issues. Major mental health issues are way beyond that, you know, way beyond that. When we look at someone that is snapping at people today, tomorrow, they're having mood changes, which are most likely minor, because in severe mental health issues, you get things like aggression, you know, and destructiveness and stuff like that. So these are things not to joke about in the office. I've been to some workplaces, oh, that one is bipolar, Joe. Today it comes to the office, is vexing. Tomorrow will come, is vexing. It's bipolar. I'm always very quick to react to such statements because I say, I'm like, you've already made the workplace such an unconducive environment for people to express themselves, to be themselves. How do you even start mental health conversations in such environments? Bipolar illnesses, schizophrenia, those things are major mental health issues that come with a lot of aggression, that come with destructiveness, so they're very serious things that we do not trivialize, we do not joke about, we do not label people just randomly just because the person is having a bad day. But what I'm trying to say now is that we should be very, very aware of ourselves. So if you see that you're snapping at other people, when you're very self-aware, you would now, when you become more intuitive and more self-aware, you'll be aware that you're snapping at people. You snapped at people today, you snapped at people tomorrow, you're being nasty. Take a step back, reassess yourself. What's going on with me? Oh, is it the news I heard from Auntie Lara about somebody's death? Is it my dog that died that is hitting me this way? Is it the money I lost? Is it the fact that I'm broke? You know, do that quick assessment, you know, and address whatever that injury and put in some first aid to address it so that it doesn't linger for too much. Remember, duration matters to us in mental health. Anger now, anger tomorrow is not a big deal. But when anger is sustained 2 months, 3 months, we're more concerned about that because it's becoming too prolonged. We're worried about that. So let's learn to pay attention to our feelings. Let's be more introspective. Let's be more self-aware and identify these unpleasant emotions or negative emotions when they come, when they appear. Now, it's important for us to learn to maintain healthy habits. You know, just like how the doctor, the regular GP, when you go and see him, he says, oh, learn to maintain healthy habits. I want you to sleep 6 hours a night. I want you to start exercise 3 times a week. I want you to eat low cholesterol food, eat more protein, less carbs, portion control. You know, we hear these things often. Well, I'm sure if I call a list, everybody knows, put your vegetables, make your food colorful. You know, we are aware of these things in terms of, because our GPs talk about these things a lot. But in terms of our mental health, we also need to maintain healthy habits as well. And some of the healthy habits we need to understand are our thinking patterns. You know, a lot of times there's so much going on in our heads. No one around us knows until our behavior changes or we carry out certain behaviors. The important thing is to assess those thoughts. So if you find that you ruminate a lot, rumination is an enemy of progress. Rumination is like overthinking. So for a lot of people, they run through the day, something happens, that activity has happened and has passed, but they find that they're thinking about it. Oh, I should have said this. I should have done it like this. I should have. So some people is when they're about to sleep at night or when they can't even sleep at night, they are now ruminating on the activities of the day, playing it and replaying it in their minds. That's a very, very unhealthy way to live. It's a very, very unhealthy way to be. Overthinking, it's important for us to learn to break thoughts, break those thinking patterns. It starts from your thoughts. So breaking those thought processes are extremely important. And it's the habits we learn that help distract us from these things. So sometimes when you find that you're overthinking or you're ruminating, you need to engage in something else. For me, I would say music really helps, because if at that point where you find you're thinking, you put on a headphone and you're singing along to the song, of course, it's going to take that thought off your mind because you're starting to sing. I would say take a pen and paper, journal whatever the troubling thought is. Journaling is very powerful. Take a pen and paper and journal whatever that issue is. Carve out a plan. If you're able to brainstorm and put down a plan, fine. But if you're not able to get one yourself, that's where a therapist comes in. Go and meet a therapist who is a neutral person who can sit with you, brainstorm with you on solutions to whatever problems you might be having. Or look for that non-judgmental friend who can look at things objectively and help you carve out solutions to whatever problems you're going through. But the important thing is that you don't want to remain in that state for prolonged periods of time. Engage in that activity that takes your mind off whatever it is you're thinking of, whatever it is that worries you. There's so many unhealthy thinking patterns in cognitive care, in cognitive therapy. We talk about so many unhealthy thinking patterns, ranging from catastrophizing, when something small has happened, but you have already seen it, you've blown it out of proportion, you've seen, how far it can go. Meanwhile, it hasn't even taken the first step. You have blown it out. You are already parrying. Some people call it parrying. You are parrying. You're already, gone beyond what it is already. That is unhealthy because it makes you, sometimes it even jacks up your blood pressure. Your heart you feel your heart beating. You're having palpitations just because you're already seeing the thing way beyond what it should be. But there are so many of them. There's generalization. There's so many unhealthy thinking patterns, labeling. Mind reading. Some people will tell you what another person is thinking about them. Meanwhile, the person hasn't even said that. Oh, I'm sure she doesn't like me. I'm sure she doesn't that. I'm sure these are what we call unhealthy thinking patterns, which are not good because they put us at risk for mental health disorders, especially depression and anxiety. So there's so many of them, which we usually look out for in therapy. Once we identify them, we put solutions, measures in place to address them. So address unhealthy thinking patterns, very important, and challenge them so you don't allow them linger. I'll give an example. A lady comes to me and says, oh, when I went to my mother-in-law's house, when I went my husband to my mother-in-law's house, I know my mother-in-law doesn't like me. I know she doesn't this, because the way she put the pot on the left, I know that she doesn't like me. You are mind reading. The woman has not said it with her mouth that she doesn't like you, but you're trying, what we call it, you're mind reading. You're already assuming, making assumptions. Meanwhile, you can just clearly ask her, Mama, is it that you don't like me? Or Mama, do you like me? Then Mama tell you that, Mama has told you with her own mouth that I don't like you. Then it's clear that Mama doesn't like you. But when you mind read, so it happens in the workplace too. People assume that their boss doesn't like them because the boss put the file in a certain way, or the boss did not mark their KPI on time, or whatever. We discourage mind reading because it makes your mind go further than it should. And you start already, your behavior starts to change in a certain way because you have gone too far. So it starts with maintaining healthy habits, first with our thinking patterns, and challenging unhealthy thinking patterns and replacing them with healthier ones. So that's another pillar that we would connect all emotional hygiene to. The third pillar is practicing self-care when we're in pain. So this emotional pain comes in randomly, unexpectedly, can happen anytime, But just like how when there's pain on the outside, you would quickly rush and take paracetamol, or for those that like to bind and cast, you put your hand there and bind and cast the pain, but you won't just leave the pain there to just linger for hours. You want to do something about it. So same thing with emotional pain. And remember, I told you emotional pain is all those things are listed, be it grief, be it loneliness, be it heartbreak, be it financial loss, be it some people get duped, all kinds of things happen. Those are all emotional injuries or which result in emotional pain. Now, when these things happen, you want to practice self-care. You don't just want to just be there and linger and lament. I've had clients who I've had a couple of clients who were duped 20 years ago. And since they were duped 20 years ago, I'm seeing them 20 years after the incident and they haven't recovered because they have just remained in that emotional pain and not been able to come out of it. They just remain there. Nobody knows what first aid measures to put in place. They just remain there. 20 years after, their children are now carrying the burden of a parent that hasn't healed from something that happened 20 years ago. So I'm sure if I ask for experiences at the end of this conversation, you can share experiences with me of people that you feel have become stuck in an era or stuck in a time, and they've just not been able to come out of that phase. And time has gone, time has moved on, everything are happening, but they've just not been able to come out of that phase. They're just stuck there. So that's emotional pain, and the person just remained stuck there, and it has now spiraled out of control into something more serious. So it's important that in those moments we learn to revive our self-worth. Yes, those things happen, they hit you hard, they hit you hard, but it's important that you need to get your self-worth back. You need to get yourself back. And that's where self-compassion comes in. Practicing self-compassion has to do with that thing you would do for a best friend. So I'll give an example. A best friend comes to see you tomorrow and is like, they laid me off from work, or this happened in the workplace. What are those things you would tell your best friend to lift them out of that situation? What are those things you would help the person to encourage them out of that situation so that they are able to bounce back? Now, those are the things we want you to do for yourself as well. Because for some people, you might not really have anyone. Like I said, if you've not been teaching them the CPR or emotional first aid, when those moments come, there's nobody to come to your rescue. So in that moment, because you're the only one with the information, you might have to rescue yourself or try to rescue yourself. In those moments, you need to practice self-compassion. Teach those things you would do to a friend, or teach a friend, or tell a friend, those things that need to be applied to you in that moment. Sometimes it means you writing it down. Okay, if Nkechi was in my shoes, what would I tell Nkechi? All those things you tell Nkechi, all those things you ask Nkechi to do. Or prepare your CV, dust your CV, start going around, drop your CV, call this person, pick up your phone, dial, all those things. Now apply them to yourself. Pick up your self-worth again. Apply those things to yourself so that you can come out of that phase as quickly as possible. I always talk about the power of help. Help is God has created help as a very important tool for mankind, for our mental health. Some people say, I don't like asking people for help. If I ask them for help, tomorrow now they will use it against me, that they were the ones that helped me. They will use it to insult me. That is a very faulty mindset, a very unhealthy mindset, which at the end of the day always leads to something unhealthy or a breakdown. Unhealthy mindset leads to breakdown at the end of the day. It's important to learn 3 things when it comes to help. We should learn to reach out when we need help. We should never be afraid to reach out. What's the worst? You reach out to someone, they say no. No has never killed anybody before. No has never killed. The only thing no can do is hit your ego. But no has never killed anybody before. So we advise that in moments where you need help, please, please, please never be ashamed to reach out for help. Never be ashamed to ask for help. And when that help is offered, please be open to accept it. That's how God has created it. Every day we're in church, we're praying, God, help me. I want to hammer. I want to this. I want to buy this. I want to buy that. But I've never ever heard of anybody that after the church service, God now threw down the money from heaven. They now saw money falling from the sky because God has answered the prayer. God always uses another human being to help you. God puts another human being in that situation to answer your prayer. So you prayed, but the answer to the prayer is going to come through a human being. But if you're not receptive to help, then you won't get the answer to your prayer. I don't know if I'm communicating, Reverend. To get that answer to your prayer, you need to be open to receive help from other people. So when that help is offered,
certainly you are communicating.
Yes. So we need to be open to help. We need to be open to receive help when it is offered. And then it's important that we learn to help other people as well. It's important that we learn to help other people. Science has shown that endorphins, that when we need to release endorphins to help us stay mentally healthy. So endorphins are those good hormones, those healthy hormones that when people come to see me in the clinic for depression, I give as pills. All those antidepressants are dishing out. At the end of the day, the antidepressants are filled with endorphins just to boost the natural endorphins in the body and get the person feeling happy again. Now, these endorphins are also released in our body when we engage in things like exercise, activities we enjoy, things like that release natural endorphins to us. But science has now shown that even when we volunteer, when we help other people, we also release endorphins. Surprising, but true. So I encourage us to also learn to help other people. Helping other people is helping and not expecting anything in return, you know. Helping just because they need the help, just helping out. It's very important. So in terms of help, being able to reach out for help, being open to accept the help when it is offered, and being able to help other people. Okay. So in terms of, so I'm going to now take this to the workplace. This is us as employees in the workplace. Every workplace is made up of individuals, you know, we're all one unit within a workplace. So if we're able to put all these things in place, of course, the workplace will be healthier. But as a workplace in general, for employers, you know, it's important. The workplace culture is key. It's very important. You know, a healthy workplace culture helps people maintain good emotional hygiene, makes people remain mentally healthy. So it's important that we define the structure in the culture in the workplace. If as an employer, as a founder, there's certain cultures if there's a certain way you want your workplace to be, so now, culture has to do with now the kind of personalities, the way people treat themselves, whether they are hostile to each other, whether they are toxic to each other. So the kind of politics you allow in the workplace is very key, because politics at the end of the day can make it a toxic workplace that people cannot thrive, can no longer thrive, and at the end of the day, chokes up the organization in the end. So the workplace culture is very, very key for people to remain emotionally and mentally healthy. So it's important, when you see the politics becoming toxic, as employers, it's important to check it. You know, it's important, don't allow politics just carry on and get out of hand. We should be able to check the workplace politics so that we maintain a healthy culture in our offices or our workplace. It's also important for the team, when we build our teams. Personality matters in team building. A lot of times when we hire people, we're looking for skill. You know, we're looking, you do the job, or what did you graduate with? But it's not just only about skill. You want to match personalities on your team. People are different. Everyone is different, you know. There are people, some people are people's person, some people are process people, you know, some people, so people come in different ways, you know. It's always important that when you find these people, you want to match them on your team. So you put the people's person with the process person, you know, with the timeline person. You want to match them so that they in terms of personality, they would complement each other at the end of the day. Because when the people's person wants to go around greeting everybody in the office and gisting and adjusting, the process person will call that person back and say, hey, we have a timeline in 5 days. We need to complete this thing in 5 days. But if you put the department is filled with people's people, they will never get their tasks done, because they are always adjusting. Every Saturday is Owambe. They will even bring the Owambe into the workplace, because that's how they are. So it's important that when you find it, we shouldn't just be focused on skill, also focus on personality and matching those personalities so that the workplace is more productive. The more productive the workplace is, everybody is happier. You know, we are all emotionally healthy. You know, productivity goes up. Also, work-life balance matters. You know, let's look at how we can ensure work-life balance. I know it's not really easy. We talk about work-life balance a lot. It is a difficult thing to achieve. It's very difficult, you know. Globally, it's a very difficult thing, but we keep talking about it because somehow we can make it happen. We can start to make it happen little by little. So we say, let's balance it. Sometimes in balancing our work and our life, we can bring some of these things into the office. So bringing exercise into the office, you know, fitness coach, get a fitness coach to come in and coach them once or twice a week, you know, emotional coaching in the workplace as well, EAP programs as well in the workplace, just to help maintain work-life balance. If you run an organization where there are a lot of new moms with babies, you know, a lot of new moms, they are working in the office, but their minds are at home with their babies. Creating that mini creche in the office to meet the needs is not a bad thing to do as an organization, just to meet the need. If you find that there are a lot of young people, they need to start their families, they need to start to buy, furnish their apartments, encouraging them to do like thrift, is it a job programs? You call them thrift or isusu or those things. Think cooperative programs so that they're able to start to see the dividends of their hard work. You know, things like that help people feel like they're progressing, you know. But if they're If they don't have, they have poor money management skills, they are working, but they are not able to see the dividend. Probably they have poor money management skill. But if you allow them carry on like that as an organization, they might work with you for 10 years and feel like, oh, I've worked here for 10 years. I'm not getting, but you pay them every single month in those 10 years, you know? So when you see a pattern as an organization, you can infuse certain things, financial planning seminars, you know, financial planning trainings, encourage Agile, you know, start a cooperative, stuff like that, just to help them move from one level to the next level. People feel like they are growing where they are. They feel more fulfilled. They're able to give their best. They're able to give more because they're seeing growth. So these are things that we should consider as employers. And then, very, very importantly, is having mental health conversations in the workplace. I always say that this is the job of our HR. You know, our HR needs to open up our offices, our workplace, so that people can share their mental health struggles. You know, everyone cannot have optimal mental health 365 days in a year. God has not created it that way. You know, every single person's mental health fluctuates on a daily basis, depending on what you're going through. If someone loses their father today and the person comes to work and is laughing, I will tell you for sure that that person is mentally unstable, because the expected response to that is that the person should be distressed because they just lost a loved one. So whether the person is a doctor, or whether the person is a nurse, or whether the person is a coach, or these things happen to every single one of us. So is anybody that tells you that mental health does not fluctuate on a daily basis is lying to you. We all go through mental health distress. It's how we navigate through this period. It's the emotional hygiene we have in place that helps us pick up again and get back in top shape. But if your emotional hygiene is poor, those things happen, you remain there. Before you know, you're down, you're ill, you're down with one mental health disorder or the other, and then physical health issues also creep in. Because when mental health issues creep in, also some other physical health issues also start to creep in as well. And before you know, the person is down with one thing and it's difficult to manage. So these are some of the tips for employers as a whole. What's my next slide? I think I've touched on everything I need to touch on. What's on the next slide, please? Okay. So I think in a nutshell, we've talked about how our emotional hygiene is very key to helping us have good mental health. The way we look at oral hygiene, the way we look at personal hygiene, you know, and hygiene in other ways, like some other people do, we should also look at emotional hygiene that way. There are measures or habits we need to put in place daily, often, so that when injury hits us, we are balanced, you know, we're standing strong, and we're able to overcome or navigate that phase easily. And it's also important for us to teach other people. It's not a conversation you should have by yourself and keep to yourself, because I told you before, when you learn CPR, you are not learning it for yourself, you are learning it for someone else. When you learn first aid, you are learning it for someone else. So teach other people around you, so that when you need it too, there are also people that can stand up for you and step up for you. Imagine the person that is depressed. A lot of times when people become depressed, they're so sad that sometimes they're not even able to even identify that they are depressed. So they're so low. But the people around them don't know that it's depression. They take it out on them. This person is lazy. This person is this. Person is sleeping too much. This person is that. You know, and they fire the person. Meanwhile, the person might just be going through depression. But they don't know. They're unaware. So when we learn things, we need to teach people around us so that we're all having the same conversation. That's where mental health conversations in the workplace are very important. We get meetings like this, we invite other people to join. We get the slides, we share with other people so that we're all on the same page and we can all teach. They said if each one can teach one, then the world will be a better place. So this is how to find us. My name again is Dr. Olayinka Jibona from the Freudian Center. Freudian Center is an addiction treatment facility, and we also manage other mental health issues in children, in adults, in elderly. We can be reached on all social media platforms. We're very active on YouTube, where we upload our radio shows. So I also have 2 radio shows on Classic and Law FM. The radio shows air every Wednesday on Law FM every Wednesday, and on Classic FM 2 p.m. on Wednesdays as well. But we upload our shows on YouTube, where you're able to learn positive psychological concepts and then apply them to real life experiences and real life situations. We can also be reached on Facebook and Instagram, and that's our website. And these are our numbers if you want to call, reach out to us, talk to us. I'm always happy to share what I know about mental health, because I believe everyone should be aware. It's a concept we don't talk about because it's been stigmatized for a long time. But now we've come to understand how important the inside, the mental, the psychological affects the outside. A lot of time people are manifesting illnesses on the outside, not knowing that it originated from the inside. And most times, if you don't treat it from the inside, you're wasting your time on the outside. So these conversations are very important, and I want us to share with as many people as possible. So I'll just open the floor now for questions, for experiences. If you know anyone that got stuck in an era or in a phase because they had poor emotional hygiene and they're finding it difficult to come out of that phase, please share with us. Share your own emotional hygiene story. What daily habits have you put in place that has helped you? And what do you think you can add to it to also help you, manage or navigate through psychological injuries? Thank you very much for having me.
Thank you very much, Dr. Olayinka Jibono. Let me just warn you that I'm sending you an invoice for that last slide. I hope you got the joke. I want to encourage Dr. Ujumu to please stay on till the very end. You have a role to play at the end. If you check your WhatsApp message, you will find what the role is. Now, let's take some question and answer. I don't know why today we are not having a full house. I want to put it down to the fact that we had a holiday here in Nigeria yesterday. Right now, we have about 52 people on this call. A lot of our usuals are not here, but it is gladdening to know that we have people from Kenya, Uganda, Tanzania, South Africa, Ghana, and of course, a lot of Nigerians here. So we have a very good reach at the moment, but not as many as we will normally have or as we have expected, because the topic itself is so interesting and catchy. Emotional first aid. Question, Benjamin Adebisi, your hand is up. You may mute yourself and ask your question.
Okay, thank you very much. And I would like to appreciate the presenter for the very great presentation. I want to also introduce what I do. I'm an honorary professor of molecular and functional neurobiology with the European Psychiatric Association. Aside what I do in Nigeria, I teach. And I was once diagnosed with bipolar in 2004, while I was in my final year in school. And, I thought it was over because several drugs were given. Some were alloperidol, chlorpromazine, diazepam, and a lot of psychoactive drugs like that. And some of these drugs, especially alloperidol, I presented the European Congress of Psychiatry in Lisbon, 2019. And I had also worked on malnutrition and social behavior at the World Congress of Psychiatry. So basically, I will appreciate the presenter because she actually looked beyond the pharmacological approach, which I actually do not agree with. Like I said, I worked on some of the drugs, especially alloperidol, and I discovered that it had cardiotoxic and some testicular toxicity effect. So basically, I really do not support pharmacotherapy. Moreover, the cause and the triggers of these bipolar symptoms or kind of episodes are sociological. There are things that are maybe initiated by the stress going on, financial strain, and all that. But Nigeria is such a close space. It's such that everybody knows one another, especially in the field of anatomy, where almost everybody in my workplace, in my department, went to University of Ilorin, almost everybody, anatomy department. So we know ourselves, we don't belong to the same set, but we know ourselves. So, rumors of this guy once suffered psychiatric episode, nobody knows what actually caused it, reading so long, spiritual attacks and all that. Nobody wants to know. But do you know that 20 years on, after the diagnosis, the statement is still being used to hunt me down? Although I'm not perturbed, really, because the goal is not even about it affecting me. It's about my reputation. And it's about how I feel. You know, when everybody keeps saying, oh, this guy was a psychiatric patient. In fact, I confronted the provost of the college, who is supposed to be a professor of medicine.
Professor Benjamin.
Yes, sir.
Professor Benjamin.
Yes, sir.
This conversation can hold afterwards, but I will just say to Dr. Jibono, can you address very quickly the issue of stigmatization? Because I believe that's what you are driving at, Professor Benjamin.
Yes, and secondly, sorry, let me just chip in this, then I will give the floor to the doctor to talk about that. Please, since this is a weekly or monthly episode, is it possible to get all WhatsApp and have a WhatsApp group where only the administrator will be posting dates for meetings? There won't be contributions from other participants, but we just know, because I saw the link yesterday on a general WhatsApp group that has over 400 participants. So I had to be searching through. So if it's possible for those people that are regular participants of this group, of this program, maybe we have a special WhatsApp group by, you know, collecting our numbers and have a special WhatsApp group, and only the admin will be sending messages on the group so that the page is not clouded in case we will be having regular meetings. I think that's more important for me to say.
If you leave your email address in the chat box, you will be listed on a contact list, and you will get both the mails and the WhatsApp messages on a monthly basis. Even the recording of this will be sent to you if you put your email address down. Okay,
that's done right away. I think I've done that right away. So,
all right, thank you. Dr. Jibono, can you please quickly address the issue of stigmatization very briefly? I know you can go on for hours on that alone. We have a couple of questions still waiting to be addressed.
The issue with mental health is because of the history of mental health. For a long time, people attributed mental health issues to demonic infestation and punishment from the gods and all that and stuff. But now, with research, that's the beauty of science. You know, with science, we learn new things every day. You know, science is innovative. Science is teaching us new things. With science, we've been able to link a lot of these things to scientific causes and stuff. But I would say that in terms of fighting stigma, because the stigma is real because of that history, let's look at other people that are fighting stigma and how they're doing it. For example, let's look at the LGBTQ community. You know, that's a community that is also stigmatized, but somehow they're making a lot of influence around the world. I know that people don't like to talk about them because they feel like they're abnormal, but the truth is that they're gaining a lot of influence globally. They are gaining influence in terms of policy, in terms of funding and all that. But how are they able to do it? It's from the fact that they are not backing down. You know, there's so much up against them, but they are not backing down. They keep standing up for their own right, for their own beliefs, which is what I believe we as mental health advocates can do. As mental health advocates, we should stand with people that are survivors of mental health issues. We should stand with it. We should fight for the rights of, thank God the mental health bill has been passed. Well, we should fight for their rights. I have patients that have gone on to do great things. You know, my patients are doing great things. When it comes to mental health issues, we have a wide range of mental health disorders, you know, a very wide range. And people have these things, people pick themselves back up, people go and do great things. You know, people do big things. You can't just call people's names randomly, but people are doing great things. So it's about standing up for the rights of people living with surviving any mental health issue. And, you know, irrespective of the forces that are fighting down the stigma, I think we should still keep standing, and eventually, be able to, we will make a headway. That's what I think.
Thank you very much. Susan from Uganda would like to ask a question. I saw a hand being raised a while back. Susan?
Thank you so much, Venerable. Yeah, my question goes to the doctor. First of all, thank you for the presentation. It was very good and excellent. My question is, how can one take care of their emotional hygiene when they are totally disconnected with their feelings and emotions? And this is after trying therapy and things are not working out. Thank you.
I think she needs to be a bit more specific. So if you say already disconnected, then maybe there's an illness going on already, or a disorder going on. That's why there's a total disconnect. And then that might require treatment. I know the professor earlier on had said he did not believe in drugs, but I believe in the power of medications because I've seen medications work. You have someone that has had depression, that has been depressed for over a year and is just in therapy, and the depression is dragging. And then you put the person on antidepressants, and in 10 days, the person is back up optimally, and they're wondering what they've been doing for a year. So medications do work. There are newer medications every day. Science, it's just a pity that Nigeria is not a manufacturing country. We consume everything. But the West, the research is going on every time, all the time rather. And with these researches, they are manufacturing new medications and there are new solutions every day. So if this individual if whatever it is seems to be dragging, maybe they should see a psychiatrist, maybe need a medication to reset things. So once you reset things, then therapy can now start to work. So you can now start to have that one-on-one again and become more self-aware and all that. So I hope I answered the question.
Thank you. Let me have the privilege of asking the last question, Doctor. When you started, you talk of the brain working optimally. How do one know or determine when the brain is working optimally?
Okay, so the brain performs different functions because there are different parts of the brain. They have different lobes, frontal lobe to temporal lobes. There are different parts of the brain. The brain is also in charge of our movement, our speech, our feelings, our emotions. So much is covered by the brain. Now, a brain that is not working optimally, you can have a person wake up and is paralyzed. The fact that the person is paralyzed shows that a part of the brain is affected. That brain is not working optimally. You can have someone with a speech impediment. So the person has been talking all their lives and wakes up and cannot talk well or cannot comprehend speech, or the speech is not, the person not giving you accurate responses to speech. That brain is no longer working optimally. Same thing too with sight, with emotions, So once there's a deviation from the norm, the person has always been a certain way. This is how the person was born. This was how the person was created. But there's now a deviation from the norm. Then there's something wrong. And then as neuropsychiatrist or even the neurologist, you can now, based on the symptoms you're seeing, you can now identify what part of the brain is affected and attempt to help the person recover. So that's it.
Very much. We have stretched it a bit far. Dr. Benjamin, you probably will be able to ask your question next month. This is the flyer for the July Connect and Learn. We will be looking at emotional wellness. Mrs. Taiwo Adejumo will be the facilitator, and we'll be looking at healing, grief, and loss. So diarize it. July 11th, 11 a.m. That's for July Connect and Learn. In August, we have a big event coming up. It is the EAP Summit in Nigeria. The title of the summit is Employee Wellness for Productivity and Performance. It's a fee-paying event. It's a hybrid event. We're going to be having 10 general knowledge speakers and about 12 different workshops, including panel discussions and things like that. So please note this date. One of my bosses is on this call, those who make it possible for us to be able to engage with you monthly at no cost to you. One of our big clients, the NLNG, I have Dr. Michelle Ujumo to please do the vote of thanks. Dr. Ujumo, please unmute yourself and then talk to your people. Dr. Michelle Ujumo, are you still in the house? She'll be talking to us from Bonny Island. Dr. Ujumo, be kind to say the vote of thanks. Are you still on? Let me quickly check. Or she may have dropped out. Last month, a dear friend of mine introduced a care group from London to join us. I believe the managing partner of the group is with us today from Fumbi Medical Center in London. Can I have the director say the vote of thanks? Thank you. You may unmute yourself and say the vote of thanks. This is something I don't want to do by myself. Well, Professor Bernard, Benjamin, I didn't see, please do the vote of thanks.
Thank you very much. Hello?
Yes, we can hear you. Please go ahead.
Okay. Yeah, thank you very much. We want to appreciate the Venerable for a program like this and for the speaker and the subsequent speakers that will be coming on the program. And I will want to say thank you to everybody that was present today, and we hope you will join us subsequently for the program. So thank you very much. We hope to see you some other time.
All right, thank you, everybody. We look forward to connecting with you in July, and we hope you will get your organization to be part of the EAP Summit on Workplace Wellness, Productivity and Performance in August. Thank you very, very much. Enjoy the rest of the working day. God bless and prosper you in all your ways.
Amen. Thank you.